Good afternoon, everyone. I'm Liz Charlotte, Director of Communications at the Mississippi State Department of Health. Thank you for joining us. We will have comments from Dr. Thomas Dobbs, our State Health Officer, Dr. Paul Byers, our State Epidemiologist, and Mr. Jim Craig, our Senior Deputy and Director of Health Protection. I want to go over some things today that have either been questions that you all have been asking or has been in the news or is breaking news. So we'll talk about vaccine numbers and allotment. We have breaking news about the Walmart pharmacies. We will talk about dedicated phone lines for those 75 and over, give you an update on the long-term care facilities. We'll talk a little bit about out-of-state vaccinations. A lot of you have had questions about that, so we'll be happy to discuss that. And then Mr. Jim Craig will, as always, give us his update on the county vaccination drive-through sites throughout the state and anything else he would like to talk about. At this time, I'm going to throw it to Dr. Thomas Dobbs.
You're on mute, Doc.
Thank you, Jim. Yeah, so today in Mississippi, we're recording 635 new cases and one additional death. Keep in mind that sometimes deaths lag over the weekend, so it's not an indicator that we're not going to see more deaths going forward. Over the past week, we have seen a decline in cases, which is fantastic news. But we do not need to use this as an opportunity to let our guard down. Just because we're making progress, that doesn't mean that we can quit doing those simple things that prevent transmission. Now is exactly the time where we need to keep up with the masks. If you're in public, you need to wear a mask around others, and we need to limit our social activities. So please keep any gatherings small and outdoors and avoid any large social gatherings. We have an opportunity right now to get as many people vaccinated as possible and try to get a lid on this thing in the state of Mississippi. If you think about kind of where we're going with the vaccinations, we are excited to look at some new opportunities. We know that Walmart is going to start offering vaccinations at, it looks like 31 different locations within the state of Mississippi. And we will publish that list later on today, which cities will have that available. The locations were chosen in a manner to try to help balance out some of the gaps, whether it's because of different communities, rural or otherwise underserved. So hopefully that will help fill some of that gap. To sign up to get a vaccine through the Walmart pharmacy, please visit walmart.com/COVID vaccine. Now in the state of Mississippi, you cannot get an appointment at this very moment, but we understand that by tomorrow, people will be able to get vaccine appointments at that website. When you put in your location, your zip code, you will have an opportunity. But keep in mind, these also will likely go very, very quickly. In addition, we have another partnership that will be coming through local community pharmacies, independent pharmacies, and when we have that list available and finalized, we will share that with the public as well. If we look at some of our other vaccination priorities, want to talk about a couple. Want to talk about vaccination for people who are over 75 and over 65. We know that people who are in these age groups are at the highest risk for severe disease and also for death. And if you look at the progress we've made, it's really been pretty remarkable. We now have 39.4% of all Mississippians who are 75 and older have received at least one dose of vaccine. And 31.9% of all Mississippians 65 and older have received at least one dose. That's going to pay phenomenal dividends going forward, but we will continue to try to make progress within these groups of people who are most vulnerable. We do have a separate phone line for people who are 75 and older, understanding that the computer access is a gap for the drive-throughs. So if you go to our call site and you hit 1 to get an appointment, there will then be an option to get an appointment if you are 75 or older, a special line so that you can get in more easily, more quickly, and make sure that we don't run into those barriers for people who maybe are not quite as internet savvy or don't have as much time to wait on a phone line. So we'll continue to work on that aggressively. And from a health equity perspective, we are continuing to work aggressively to try to help balance that gap. At present, 19% of vaccine has gone to African Americans, and that has ticked up just a little bit, but not anywhere near where we're satisfied. We're continuously monitoring which locations are most successful at getting vaccines to our African American communities. And those will be areas that we'll continue to support aggressively to make sure that we can sort of balance that gap. We know there's a trust gap, and we've been working on that, but the access gap cannot be overstated. So expect to see other innovative approaches in the coming weeks as we work to try to overcome those barriers for Black communities. And the last thing I'd like to just talk about real quickly, we also are excited about the possibility of having another vaccine, Johnson & Johnson, or also Janssen. It's a partnership vaccine. It's a single dose vaccine, and a lot of people are very excited about that. We don't have full data on this, so we are eagerly anticipating getting these reports. FDA plans to do a review of this vaccine for possible emergency use authorization. Probably several days after that, it might be available. When we think about this vaccine, there are some benefits in the fact that it is a single dose vaccine, and it's easier to store. So we know that's going to be a lot, a great advantage for this vaccine going into the next months. It does seem that it has 85% efficacy against severe disease, and it looks like in the studies about 100% efficacy to prevent hospitalization or death, which certainly is very important. It is not quite as good at preventing any symptomatic illness when compared to Pfizer and to Moderna. So that's something we'll have to look at very closely, but we are encouraged to see that the vaccine does show great promise for preventing severe disease and death. So at this time, I'll turn it over to Dr. Byers for additional updates.
Thanks, Dr. Dobbs, and good afternoon, everybody. And just to kind of jump on with what Dr. Dobbs had said, we did report out a lower number of cases and a lower number of deaths than we have reported out for a number of weeks now, and that's encouraging, and we're glad to be moving in that right direction. But just to kind of put it in perspective, in the month of December, we did have over 1,000 deaths. We had over 1,000 deaths in January, and many of the deaths that are still being reported now coming up will be deaths that are occurring in January as well. So we're not through counting all of those deaths that have occurred at that point. So now's not the time to let off the gas. Now's the time to continue to do those non-pharmaceutical interventions that we've been talking about the whole time. A vaccine is a big part of that. So even with the vaccination, we need to continue to wear a mask, socially distance, avoid those larger gatherings outside of our internal family, and limit our activities as best we can. With the number of doses that we've administered so far in the state, it's been over 340,000 doses that we've administered, and that includes over 270,000 Mississippians who've received a first dose in the state. An important component of that is what we've done through our drive-through clinics, and we have vaccinated over 117,000 individuals with the first dose through our drive-through clinics in the state, and an additional 10,000 plus folks have received a second dose. When we look at what's going on in our pharmacy partnership, and we've talked about this quite a bit, and that's that partnership that is through the federal pharmacy program that includes both CVS and Walgreens, with the goal to vaccinate both residents and staff in long-term care settings. And so far to date, 25,288 individuals through that program in long-term care settings have received that first dose. An additional 9,248 individuals have received a second dose. Still a long way to go in that program, but every one of those individuals who's vaccinated is encouraging, and we want to continue to work with them to ensure that those folks continue to get vaccinated. We know that many of the facilities have already completed their first dose appointments. We have a whole number of them that are now getting a second visit to complete the series, and then there will be a third and final visit to those long-term care facilities to get those folks who didn't get vaccinated previously. And like I said, we'll continue to work with those programs to make sure that we can ensure the vaccination. As Dr. Dobbs said, we have had some success with our 75 and older and our 65 and older individuals, and he reported out the percentages of those individuals that we have vaccinated. I know that recently we've had a number of questions about vaccinations of individuals out of state. And, you know, currently in Mississippi, to be eligible for a vaccine at a vaccine provider in the state or at our drive-through clinics, you need to be either a Mississippi resident or an individual who works in Mississippi. And that can include individuals who are eligible otherwise, who are healthcare workers or work in any setting in the state, because we know that it is important to get those individuals who are in our state working and spending time in Mississippi vaccinated and covered as well. And that's our current eligibility. Right now, 6,777 individuals with out-of-state addresses have been vaccinated by a vaccine provider in Mississippi. But again, I would encourage you to look at that we have administered a total of 334 vaccinations doses so far in the state, compared to those 6,777 individuals who have out-of-state addresses. Many of those, more than likely, who work in Mississippi as well. And so I'm going to turn it over to Mr. Craig to talk about the changes that we're doing in the drive-through clinics and the schedules coming up. So thank y'all.
Yeah, thanks, Dr. Byers. We're still operating the 19 state drive-through locations around the state of Mississippi. Again, those were set up in a regional concept with at least two of those sites in each one of our regions, based on access of the major highways, larger areas, in sites where we could run at least 1,000 appointments a day. This is a week where we're doing a number of days with 1,000 appointments for both Pfizer and Moderna vaccine through the state drive-through locations. We also have some county drive-through locations that the state is supporting. One is in Warren County, another is in Lawrence County. And I guess the news today is that starting tomorrow, we'll have some scheduling available for Bolivar County. Bolivar County is coming online. They'll be using the campus of Delta State University in their football stadium parking lot as their site. So we're excited to have that county location up and running starting February the 23rd. In other news, we also have changed our location in Madison County. We were at the Madison County Health Department operating our vaccination location there. We have moved to Canton High School at 634 Finney Road in Canton, Mississippi. Folks that had appointments at the Madison County Health Department, those appointments have been moved same day, same time, new location to the Canton High School. We had a great call last week with a number of the mayors, the emergency managers, boards of supervisors, and others about vaccination efforts in individual counties in different ways that they may accomplish that. County drive-through operations may be one of them, and we've developed a checklist to help counties to make sure that they have thought about all the things necessary to operate a county location. And we're also working to provide some technical assistance in that area if they're interested. But county drive-through locations are only one of many ways. The partners that are continuing to assist with the vaccination and the healthcare side of the world is another big player in our county vaccination efforts. Been some questions about whether we should expand hours. That is something that we're always exploring, but vaccine supply is a limiting factor right now. The 30,000 doses that we're administering each week through the state drive-through locations are easily managed through our sites from 9 o'clock in the morning through 4 o'clock every afternoon. Just a reminder on scheduling. The scheduling system's up and available and is at covidvaccine.umc.edu, as well as our hotline number at 877-978-6453 is open from 7 a.m. to 7 p.m. 7 days a week. And as was mentioned a little earlier by Dr. Dobbs, those over 75, as they call that line now, can select to talk directly to an operator so they can get their appointment scheduled if they're over 75. It's also important, just as a reminder, if you'll help us, make sure that you bring your vaccination card back to the site when you do your second dose, it does help us a lot in processing you through the site. And that's all I have. I'm going to throw it over to Liz so she can start with some questions.
Okay, thank you to all of you. This is from Ross to everyone. Has the health department given clearance for Hal's St. Patty's Day Parade in Jackson? Can it be put on this year safely? Dr. Dobbs.
Yeah, so I have had some brief communications with the organizers, and I know they've been talking to the city. There's nothing has been decided about that. You know, as we look at these sorts of events, whatever we do, we just need to make sure that they're done in a way that continues to use those safe distancing and masking requirements that we know are going to mitigate disease. Outdoors can be done safely. I think just wait and see. There may be an opportunity to have it, but it would certainly have to be done in a way that has safety in mind.
Okay, thank you, Dr. Dobbs. From WJTV, what can you say about the disparity between whites and African Americans being vaccinated still? Are you satisfied with the latest numbers from Black communities? I think we've addressed that. We are not satisfied, and we certainly need to continue to work in this area. Dr. Dobbs, can you address that?
Yeah, so we know it's a challenge. It's a challenge for Mississippi, and it's a challenge for our nation. We have been working, as you have seen, aggressively to work on the trust issue, and I think some headway has been made in that. But the access issue is huge, and so we have identified select partners that are more efficient at reaching Black populations, and we also are looking at other innovative approaches that you'll see in the coming days. I don't want to give anything away to help broaden our reach. So not remotely happy with it. We've also been working to reduce barriers because we know sometimes internet is a barrier. Sometimes our partners are able to help us with that also. And even some of our community partners are doing mobile clinics in locations that are especially helpful. You know, I won't speak for them, but that's been fantastic. We've had some of our partners go to Black churches and do sites there where folks feel comfortable. So a combination of going to good locations where folks are comfortable, lowering barriers, and making sure we're getting vaccine to physicians who have large African American patient loads is going to be a successful approach. But we're not anywhere near closing that gap.
Well, I see both of you guys nodding. Dr. Byers, did you want to add anything to that?
No, I think Dr. Dobbs covered it. I mean, obviously, it's something that we need to continue to work on, and that's why, you know, we're looking at the data, and we're looking at the data for the providers and the vulnerability groups that individual providers are vaccinating to make sure that we get the reach to those African American populations, and you know, we're working with the providers to help target those groups. And I think, you know, it's a problem that we're recognizing, and it's a problem that we're addressing. And hopefully we're going to be following this over time to see some improvement moving forward.
And Jim, I think this was an issue on our call on Friday. You're certainly working with the mayors and the boards of supervisors and the EMAs to work on this issue as well.
Yeah, I think everyone addresses this as an area that we want to work on in Mississippi to make more access for vaccine and to look at what those barriers are and see where we can resolve those barriers. And I think what we heard on the call was there are a lot of people interested in helping with this mission.
Ross, we will have a list of the Walmart pharmacies after the press conference. So as soon as I can get that up, I will. Let's see, from Shalina, how many doses to date have gone to people who are from out of state? Well, I think we said that, didn't we, Dr. Byers?
Yeah, and you know, from what's been entered into our vaccine immunization registry so far, 6,777 individuals with out-of-state addresses so far have been vaccinated by a Mississippi provider.
Okay, and what do you plan to do about people coming into Mississippi getting those doses again? We have said over and over, if you live in Mississippi and meet the criteria, you are welcome to come. If you work in Mississippi but live in another state, you are welcome if you meet the eligibility requirements to get your vaccine. Connor, from the Enterprise Journal. How have Louisiana residents been able to get vaccines in Mississippi? What type of identification checks are there at vaccination sites? So I brought this up because we have gotten a lot of traffic on this. We've already given you the amount of out-of-state folks, and we do not do identification checks. We are not going to be a barrier to anyone who qualifies and is eligible for the vaccine.
And if I could throw out something
Yeah.
too, Liz, at our drive-through clinic sites, we've given almost 130,000 of the vaccine statewide. But remember that there have been 334 doses administered in the state. And these are administered through our partners throughout the state, clinics, hospitals, into the long-term care population, employees at long-term care populations. And they determine their own requirements for who gets vaccinated within their facilities, following those eligibility criteria that we outline.
And Kingfish says, why haven't licenses been checked for residency? Well, of course, you don't have to just live in Mississippi. You can live in Tennessee, Alabama, Louisiana, and if you work in Mississippi, you are eligible to get the vaccine. Do one of you guys want to take that on for a second, Dr. Dobbs?
Yeah, so we don't want barriers. Right now, we're fighting barriers. We don't want to create barriers. To get a vaccine in Mississippi, you're supposed to be a resident or work here. If you get a vaccine here and you don't do either, when you fill out the application, you're being dishonest, right? So there is a step in the process where we have to depend upon people's ethical behavior. And it's obviously unethical to be misleading and lie on your enrollment. But we don't want to have someone who's older and that doesn't have a driver's license having an impediment to getting a vaccine because they don't have a driver's license or they don't have ID. So, it's certainly, it is an issue that we're aware of, and we'll try to make sure people are aware of it. I think the magnitude of the problem is probably not really severe. I think it's an interesting story. It's an interesting anecdote. But I think by and large, the main story is by lowering barriers and increasing access, we can get Mississippians protected as quickly as possible.
Thank you, Dr. Dobbs. Melissa from WDAM, the positive case numbers in Mississippi appear to be going down. Is that related to less testing? Do we have the number of people tested?
I don't have that with me at present, but this is a real decline in cases. It mirrors other data points, right? We don't ever monitor just one data point. We look at daily hospitalizations, we look at COVID-like illness surveillance data, and they're all tracking the same direction. So this is a real thing, and we need to build on that success. If we want to avoid deaths and if we want to get back to some sense of more normal behavior, the best thing we can do right now is not only do what we're doing, but do it better, not to let our guard down.
And if I can add, look, this is a pattern we've been in before, where we have had big surges and people have really buckled down and worn their mask and really tried to social distance. And we've seen numbers decline only to stop doing those things that we know that work. We don't need to keep learning this lesson. We've learned it already. We know we're on the downside with some cases decreasing and potentially deaths decreasing over time. We want to continue that. And honestly, between that and the vaccination is really how we're going to get things back to normal.
Thank you, Dr. Byers. Alex from Mississippi Today, what is the window for getting the second shot and what happens if you miss it? So there is some leeway on that. I'll let one of the docs address that. Also, are there different side effects or degree of symptoms from the second doses? So, Dr. Byers, why don't you take that first question about the window for the second shot?
Sure, I'd be pleased to. Thank you. So for the Pfizer, the recommended window of getting the second dose is between 3 to 6 weeks. For the Moderna, it's between 4 to 6 weeks. And as close as you can get it to to that 3-week time frame for the Pfizer or the 4-week time frame for Moderna, but you've got that cushion built in. So you've got a range of time that you can receive that second dose, and that's very helpful.
And also, are there different side effects or degree of symptoms from the second doses? Sure, we have anecdotal information, but would one of you all like to, Dr. Dobbs, would you like to try that?
Yeah, sure. We have anecdotal, but we also have statistical data based on reports. The New England Journal did a pretty thorough review, like a real publication that was very similar to the FDA submitted data. And it's just like we thought, a significant fraction will have some temporary, fatigue, muscle aches sort of thing after the first dose, and it does tend to be a little bit worse after the second dose. And I think that sort of mirrors our experience, but people do recover from it very rapidly. And certainly that also is well understood. We certainly also see that people who've had COVID before, when they get their vaccine, their symptoms are a little bit more intense with those sort of inflammatory things. Now, keep in mind, the vaccine cannot give you COVID. What it can do is it can stimulate your immune system. And sometimes when it stimulates your immune system, those inflammatory chemicals that are circulating in your body cause those symptoms. So it's just an indication of an activated immune system and does not mean that you have anything else more worrisome going on. CDC did a briefing today, and they talked about our side effects, and the side effect profile is really fantastic. They've seen a very rare incidence of anaphylaxis, but other than that, no serious safety signals. And there's some new rumor about old folks dying after the vaccine. They have not seen increased mortality rate after the vaccine. There has been some sort of random association timing that they would be expected anyway. So there are no deaths associated with the vaccine.
Okay, thank you, Dr. Dobbs. Rachel from Politico, is there anything you need from the White House in terms of messaging on social distancing, masking, and/or guidance on the restrictions reopening? So, Rachel, we work very closely with the CDC, and as far as those type of messages, we are doing well, but we always work in partnership with the CDC. Thomas, would you like to add anything to that?
Yeah, we just need steady, clear, science-based guidance that is, really something that we can go forward with that works, right? And I, like as an example, I do think that the travel recommendations for masking and that sort of thing makes a lot of sense. And so those are the sorts of things that I think that are going to help us going forward. These are things that aren't overly disruptive. People may find them slightly annoying, but they're things that are going to help protect people. And that's what we need, is we need evidence-based policies and interventions and stability going forward, because we know that we can't do something for 2 weeks and let off the brakes and expect for the rebounds not to happen.
Thank you, Dr. Dobbs. Kobe with MPB, how much is the state working with local community health centers to get vaccines to the underserved communities? Do y'all know how many doses may be going to those facilities? I would either throw this to Dr. Byers or Jim Craig.
Well, I probably know more than the rest.
Didn't mean to insult you, Dr. Dobbs.
No, that's okay. We work with them very closely. We actually had a meeting with all the community health centers last week. I have probably get 10 or 12 texts from different people who run the community health centers every day. Got a couple this morning already. So we have found them to be invaluable partners. They have geographic reach, they cover rural areas, and they also cover minority populations. And if we look at the number of African-American people that have received vaccines within their clinics, 71% of the vaccines that they use go to Black Mississippians. We've identified them as invaluable partners in this fight. And just last week, with our available allotment of vaccine that was beyond the drive-throughs, community health centers were ordered 3,000 doses. That's the biggest segment of doses of vaccine. So you can see how seriously we take this partnership.
Thank you, Dr. Dobbs. CJ from WLBT, if you're not checking for residency verification through IDs or licenses, how do you truly know that X number of people over 75 that got the vaccine are actually all Mississippians, for example? What are your thoughts on people coming here from other states to get vaccines when tens of thousands of Mississippians still need them? I think we've talked about this, but which one of you gentlemen, why don't I start with you, Dr. Dobbs, and then I can certainly throw it over to the rest of you guys.
Yeah, so these numbers are based on people with Mississippi addresses, and Paul can speak to that. So the numbers we're talking about are people with Mississippi addresses. Now, I'm going to just make sure everybody knows that a lot of Mississippians are getting vaccines in Louisiana. I know that on the coast, a lot of folks have physicians across the border in Slidell, New Orleans, and I know a great many of them have been vaccinated. So I do think it's not as, I mean, certainly we want to preserve Mississippi vaccines based on that's how much we get, and we'll continue to monitor it and we'll try to intervene in a way that makes sense. But we also can't raise unnecessary barriers going forward. I mean, it does speak to the challenge of not having a unified national standard of who's eligible, and Mississippi's been more aggressive and making sure that we can try to include as many of our vulnerable people into the eligible pool. But it does create challenges because cross-border folks are not able to get it for those same criteria.
Dr. Byers or Jim, do either one of you want to add anything to that?
No, just to remind everybody that really what we are trying to do, guys, is to make sure that we have it available for those people who live and or work in Mississippi. And we want to make it as broadly available to those groups as we can. Our target is to protect people. Our target and our goal is to prevent infection and prevent severe outcomes. And I think that we need to continue to do that.
Thank you. And I think you made a good point, Dr. Dobbs, that we have Mississippians going to other states to get their vaccines as well. Let's take this from Mary Perez at the Sun Herald. What percentage of COVID-19 tests are being screened for variants? Dr. Byers?
You know, I don't have the total percent of tests that are being screened, but I can tell you that we are sending samples to CDC every week. And we are actually broadening our surveillance for variant strains in the state through a number of different ways. And you know, again, we haven't identified one yet. We're looking for it. We're actually increasing our efforts to look for any variants. And certainly we will let y'all know if we identify some. The fact that we haven't identified a variant yet doesn't mean that we haven't had an individual in Mississippi who may have had one of those variants. We just haven't identified it yet. I think it reinforces that we all need to do those things to prevent transmission in the state. And you know, whether it's a variant strain or whether it's not a variant strain, if you're positive, you need to isolate at home. Your contacts need to quarantine. Your contacts need to get tested. Don't go to work sick. Wear your mask. Do all those things that we've been saying, whether it's a variant strain or not. And that's the way that we're going to get through this.
Thank you, Dr. Byers. This is Bracy with NBC. Can you detail some of the innovative approaches you all are considering to improve access? You previously mentioned a group of physicians who approached you about mobile vaccine clinics, for example. Second, is there any support from the federal level, whether it's personnel or funding, that's needed to increase access in underserved communities? Dr. Dobbs? I think you're muted, Dr.
Yeah,
Dobbs.
sorry, I did it again. So I think once again, partnerships are going to be key in this to get that sort of reach. And obviously the community health centers are really important partners. But there's also, prominent Black physicians who have patients who are in need of vaccination. And so that's going to be part of it. If we think about other things that are going to be happening, obviously the mobile clinics, we're going to look at doing some other partnerships with localities. I don't want to give it away yet, but we do have some stuff sort of in the works. The other things that we do also have a health equity branch that's devoted on this. And so we may try to continue to make sure that folks have access to vaccine, either through connections or through whatever we can do on our own. You know, our Department of Health resources are absolutely tapped out as far as like through the drive-through clinic. So it's not like we have people sitting around with nothing to do. If you'll notice, most of our county health departments have had to be closed many days because you can't do more than one thing at a time. Partners are going to be huge. If we talk about what the federal government can do, I do think there's some things they can do. I'm hopeful that with the pharmacies that are being selected, that they will help reach communities. But again, there are these barriers. So for Walmart, at least what I've seen so far, and there's probably going to be a phone number, but you have to sign in and you have to have an email. So you have to have internet access and an email account, at least for the steps that I've looked at. So those are barriers that we have to always be aware of and make sure that we don't let those be a problem. I think when we talk about our federal support, it's also important to think of this in the context of pre-existing infrastructure. A lot of times in these challenges, we come along and just say, hey, what can we do to solve this problem? But if we look at what really is driving excess mortality in different populations, if we look at the State Medical Journal published an article that we worked on looking at mortality within hospitals and what drives mortality, it's hypertension, heart disease, obesity, and diabetes. And so these things are all intertwined. And so I think improving infrastructure for at-risk populations has got to be a foundational philosophy, not only for now, but going into the future, whether that's community health centers, but also with public health infrastructure, which has been horribly denuded over the past couple of decades.
Okay, thank you, Dr. Dobbs. Steve from SuperTalk, when do you believe that teachers and first responders will become eligible, and how long until the general public will follow? Who's going to pull out the crystal ball?
Well, I'll just say that, we're making progress on our vulnerable groups. And 40%, 39.4% of people over 75 have had at least one dose. As we continue to make progress, and as we reach more and more of those highly vulnerable folks who want to get vaccinated, once we see some slack in that, that's going to be a signal that maybe it's time to open it up a little bit. I do know that the governor and his team are very interested in getting it to first responders and teachers. And I'm certain that as soon as there's a window of opportunity to do that, that he's going to want to pull that trigger. I personally don't see it, this week or the next week even, but hopefully very, very soon. And then for the general population, it's hard to know kind of where we'll go from here. When we have the access to the Johnson & Johnson vaccine, that may be a little bit of a game changer, because we're going to have broader variability for a single shot vaccine. And so that may open up things more. I think it depends upon the demand for the new vaccine as well.
And currently about 1.2 to 1.4 million Mississippians are eligible now for vaccine.
That's right. So a lot of it comes down to the amount of vaccine supply, really, and how quickly we can do this. We can only work with what we're given. Let's see, this is Shalina. It is obvious that many of the people who are coming in from out of state are not working in Mississippi. There are numbers online platforms where people are discussing how they can come to the state for appointments for their grandparents or people with underlying conditions. Clearly not just healthcare workers. Well, remember, anyone who works in Mississippi and lives in another state is eligible. What does it mean for second doses? So I think we've addressed, I'm aware of those online platforms, but I think that we've addressed those issues. But if anyone would like to add, how is the state addressing this? And what does it mean for second doses? Dr. Byers, second doses.
Yeah, well, we have a first dose tied for every second dose. And so if an individual in Mississippi has received a first dose in Mississippi, and they're a Mississippian or they work here, there's going to be a second dose for them if they got a first dose here.
Okay. From Kingfish, how many school districts are closed to in-person learning for the semester, not including temporary closures? Would we have that, or the Department of Ed?
So we have the number that gets reported to us are the schools that are currently open, and the numbers of cases that they have, and the number of quarantined individuals. And just to kind of put it into perspective, we have about 1,200 schools in the state, and almost 900 of them are reporting to us on a weekly basis of the numbers of of kids that they have and the number of teachers that they have who are either positive or on quarantine, the number of outbreaks, et cetera. So it's easy to say that at least we have almost 900 of the schools currently in session, in-person learning, or in some cases hybrid learning. So, we do get a lot of information from the schools, but we don't have a number that's reported to us when they are on all distance learning.
Okay, thank you, Dr. Byers. Candace, have there been any issues with people not being able to schedule their second shots? If so, why? Dr. Dobbs, you addressed, or Dr. Byers, you said where we've given first doses, there is allocation for second doses, correct?
There are, and I, of course, we're really more in direct control of the second doses for the drive-through centers, right? And so we're trying to make that easier. Second doses are available, but they may not be available exactly on the 3-week or the 4-week mark, right? So you can wait. You got 3 weeks after you have up to 6 weeks after Pfizer, and then up to 6 weeks after Moderna, and so there'll have to be some flexibility in there. We did have some folks who had some challenges, especially if they're older. So we have the 75-year-old line, which hopefully will help. And then also this week, and Jim, I guess we started today, right? We're doing second dose appointments on site. So after you get your first dose. So I don't know, Jim, if you want to add to that at all.
I was just going to say that there are second dose appointments available, and as Dr. Dobbs said, it may not be exactly on the date that is either 28 days after a Moderna shot or 21 days after a Pfizer shot. But the new feature, I think, is hopefully going to assist as people get their first shot and they go to the 15-minute lot. They receive an email that they can click on the link and really just update their existing appointment. Before they had to go in and almost make a second appointment, filling out all the demographic information, et cetera. Now they don't. Really, you just update your first shot appointment to indicate what day and time you want to come back for your second appointment. So we're hoping that's going to be easier and, again, remove a potential barrier.
Thank you, Jim. Okay, JTV, how do you determine someone still works in the state to qualify? I think we have talked about this enough, guys. We've told you what our philosophy is. We've explained to you what the criteria is. From Anita Lee to everyone, what is the latest medical info on effectiveness of Pfizer and Moderna against South African and other COVID variants, given it's just been reported that AstraZeneca is not working well on the SA variant? Why do we take that one first? Who wants to catch that one?
Yeah, I could start. So, the variant issue is going to be really huge as we go forward. I know I did see a study where the Pfizer vaccine looks like it's effective against the South African variant. Haven't seen anything on the Moderna yet, but and it just may well be I haven't seen it. We do know that the studies that they did, especially like with the AstraZeneca, didn't work as well against that strain. So we'll have to continue to watch it very closely. We do hope that even if we do see some variants that are more difficult for absolute control, we'll still have sort of moderation of severity of illness. So it doesn't mean it would be a total loss. But obviously we'll watch this very, very closely. And there was something. So the criteria for hospitals receive first dose. Well, every hospital's had a first dose, to my knowledge, for their folks, and should have used whatever extra they had for their community if they had any leftovers. We are working with multiple hospitals across the state trying to get it out to communities, and so if they want to be a community provider, they can get with us. But to my knowledge, every single hospital has had first dose.
And the list that we post on our website is updated weekly. So those represent the facilities that have just gotten a recent allocation of vaccine so that they can offer that to the public. So, it may be that it's a hospital that hasn't gotten doses within the last week or so, and that's why they're not on the list. So I would encourage folks to look at the list that we post. We're working on making that list a little bit more user friendly so that folks can find where they can get a vaccine, and it will include our drive-through sites. And that list is going to be updated weekly based on where we send the vaccine to. based on those external partners. We give
Yeah,
it.
and let me say that, there's just not enough vaccine, right? Of the providers who are enrolled to give vaccine, if we gave some to every single provider, every provider would get 10 doses. Every hospital, every clinic would get 1 bottle of Moderna. That's all you could have. So it's a phenomenon where the demand part exceeds the supply. So there's going to be some targeted strategy about making sure we get it to populations that don't have it, because if you live in a community that has drive-throughs or better access, that's great. But if we don't, then we need to target more vaccine to those areas where they don't have that. So there will be some variability. It's
Yeah.
just inevitable.
Just to build on that too, like you said, I think we have about 1,100 enrolled providers, and it's we try to spread that vaccine around equitably, as we discussed, to reach the target populations that we're really looking for as well.
Okay, thank you, Dr. Byers. Okay, Alex, what do we know yet about the rollout for university staff? Initially, I think professors were in phase 2, or they'd also include graduate and student teachers. So we've kind of moved away from phases right now. So I don't want us to get stuck on phases. I think we've talked a little bit about moving ahead, but Dr. Byers, why don't you grab that one again?
Well, and like we've talked about, we know that there are other groups that are important moving forward. And right now, with the eligibility criteria that we have, and especially with it being in the vulnerable populations of 65 and older and 75 and older, those particular groups we know have had some severe outcomes. As Dr. Dobbs said, as we move through and we watch what the penetration is for vaccination in those vulnerable groups moving forward, that's how we're going to help make the decision about who are the next groups eligible. And I think, educators, especially K-12 teachers and first responders, will be one of the big targets moving forward. We'll have to see how the rest of it rolls out as we get there, based on the vaccinations and the number of doses we get each week as well.
Okay, I kind of got a little bit, give me a second here. Okay, Kobe from MPB. What are the expectations for getting more doses of the vaccines in the coming weeks? How will the new vaccines from Johnson & Johnson or AstraZeneca be used in vaccine expansion? Dr. Dobbs, would you like to start with this?
Yeah, so we anticipate that we should get steady, maybe slightly increasing supplies of Pfizer and Moderna. Wouldn't expect anything dramatic, but we do think that at least where we are going forward, we have some degree of reassurance, barring any sort of unexpected circumstances. Certainly if we can add Johnson & Johnson, AstraZeneca, that'll be fantastic. I mean, it'll markedly improve access to vaccine. It'll complicate the choice question, right? I mean, what vaccine do people want? And so we'll have to work on making sure we do proper communication and education so that people can make an informed decision. But yeah, no, I think it's positive. I mean, we're making great headway. It's just not as fast as we'd like, but having additional options can only be good.
Okay, thank you, Dr. Dobbs. Do we know yet how long the vaccine lasts? That's a good question. Is it something people will have to take regularly, like flu shots? Another good question. Dr. Byers?
Well, I don't know that we have hard evidence about how long the vaccine lasts yet, but what we hope is that it's gonna be months. I suspect it'll be close to a year probably, but we've got to wait and see how this rolls out, and certainly how the variants play into that. And I think the part about getting a vaccine, similar to a flu vaccine, maybe, but I think it's really too early to predict what that's going to look like.
Dr. Dobbs, anything to add to that?
Not really. I mean, the variants are going to be huge, and it may well be that we need a booster dose that's somewhat attenuated to be more effective against the variants. I mean, but that's really speculation, to be honest. I mean, we really don't know, we know what we need to be doing right now. We need to prevent transmission and get vaccinated. I mean, sometimes the answers are so obvious, it's hard to even think too much about it. I mean, we just prevent transmission and get vaccinated. We'll be in fabulous shape in a couple of months. But it's got to be the mask and the social stuff. We just got to give it a break for a while.
Okay, and just a quick reminder to the media out there, Shalina, Alex, I need y'all to send me your media outlet when you ask questions, please. Thank you. Shalina, are you oh wait, no, I missed Michaela. Okay, Michaela from Kaiser Health News. Are there any plans to take vaccine to at-risk teachers and other essential workers who qualify under current guidelines but can't leave work easily to get into drive-through appointments?
Yeah, we've talked about after hours and stuff. The first thing I would like to say is to employers, this is so important. I just can't imagine that you can't get a doctor's sick time to go get a vaccine, right? So please, if someone needs a vaccine and they have an appointment, I can't imagine that you wouldn't be able to do it. So please do. We are looking at after hours, and certainly a lot of our partners have different clinics, weekends, et cetera. That's great. As far as deploying teams on site at a school, I don't think that's practical right now, given the logistics of having to do this. And like I said, all our teams are tapped out. We're closing county health departments every day so that we can staff these things. So, but I do think that those sort of opportunities will be more available once our partners get more and more vaccines. So there probably will be, but I think the main thing is take advantage of the opportunities that exist right now.
Okay. Shalina, are you all collecting data from hospital systems on how much of their staff has been vaccinated? Guys, anyone want to take that?
Yeah, we're not. We're collecting the information on age groups. The hospitals and the health systems themselves will have the information on the healthcare workers and the uptake within their system.
Okay. Candace, okay, writing here directly to me. Have there been any issues with people not being able to schedule their second shots? If so, why?
I think we did that one earlier.
Okay, I got a little bit out of order here. Okay, so just let me know because he's got a little messed up. So we did do Melissa Rodemaker. I think we did do that. And I think we did.
No, we haven't done her yet.
Okay, so we know you're adjusting to new timelines for each phase and group, and we've seen slots fill up in a matter of hours. We haven't moved past the age 60 plus group. Okay, so we have kind of talked about that. Who is next and when?
Yeah, same thing. We're just, we need to really focus on our groups now and get them addressed. Keep in mind, 1.4 million Mississippians already qualify. I'm not sure when we'll do the next, but I do think, the next week or so, we're probably going to really just try to consolidate our gains with the current groups.
Just a reminder, it's not just the 60, 65 and older, it's the 16 to 64 who have those underlying healthcare problems, or any healthcare personnel, regardless of age, or underlying healthcare problems, and any resident of a long-term care setting. And so we have pretty broad eligibility criteria right now. In some cases, much broader than some of the surrounding states.
Okay, this is from Alex. Is the state planning on changing the split in the overall vaccine distribution as a way of reducing disparity, such as giving a larger percentage to community partners?
There's two answers to that question. One of them is, if we look at the location of our partners, like the community health centers or dialysis clinics, it's like 72% or 71% of folks African-American getting vaccinated. So we know where the easy targets are. And so we have done a little bit of a prioritization where we know that it's going to be successful. But the other piece of it is where we've seen increasing allocations week after week, although modest, that has not translated into more drive-throughs, it's translated into more partners. So we're not taking away from the drive-throughs, which have been wildly successful, but we have been using that increased allocation to go to our community partners. and with those targets.
Okay, Ross is asking, and I don't know if we know this on our breakdown, how many doses will be available at Walmart? How's that gonna work, y'all?
I mean, we know how many are available next week. Paul, why don't you go ahead and.
Yeah, so the doses are federally allocated. They don't come out of the state allocation. And I believe that they're going to get, I think, 200 doses a week per store, which may increase, depending on the uptake. We'll have to see how that plays out. But that's not an allocation that's coming from the state. That's coming from the
Right.
state government.
So it's not taken out of our allocation?
No, it's not.
Okay, and I think Anita wants to follow up. Can you tell us when you expect supply to increase and by how much? Which I think we've addressed that, haven't we, y'all?
So last week we got a little bit over 45,000 first doses allocated to the state. So we've had some gradual increases. A couple of weeks ago, we were talking about 37,000 doses that we were getting, and then we got a little bit over 40 in the previous week, and then last week 45,000 doses. My suspicion is we're going to probably stay around that number for a while. We'll see if there are any other additional increases coming up, but I don't see us dropping back to a lower number. I see us holding steady right now at that number, and maybe moving up in the coming weeks. We'll have to see.
Okay, this is a good question. Is the phone number for age 75 and up to call the same as the regular number? It is the same, and I think there is a prompt specifically if you are 75 and older. Shake of the head, guys, is that right?
Yeah, it's the same number, and I'll put it in the chat box. It's 877-978-6453. And if you hit the, if you call the number, it'll say press 1 to make an appointment, or to maybe ask a question about existing appointment. Press 2 for the general questions hotline, and then after you press 1, there's an option for 75 and older specifically, but it is the same number.
Okay, thank you. Okay, I think Anita wants a little bit of clarification. She said, sorry, I meant first doses for public clinics or hospitals. We have a hospital apparently not currently receiving first doses in South Mississippi.
They're not the only one. Every hospital hasn't gotten doses for public clinics. So it's not a universal thing of the different places. So, if they can contact us if they want to, but we also need to make sure we balance it out with the gaps. We may well do it, but it's not unique. It's not like they've been left out specifically. But if they want to get involved, we can try to work with them also.
Okay. So do hospitals typically get in touch with you all and say we want to be a provider? How does that work?
They're communicating with the immunization office.
Okay. Okay. Let's see. Shalina, thank you for telling me who you're with, NPR. From CJ. The governor expressed concerns a few weeks ago about a national statistic that said 1/3 of long-term care facility staff were agreeing to take the vaccine. Do you know the percentage here? Is it better? And what are your thoughts on this reluctance among employees who protect the most vulnerable to get the vaccine themselves? It is critically important that those protecting the vulnerable get their vaccine. Dr. Dobbs?
Yeah, so, Paul may have some details, but I don't have any specific information on the percentage of the employees, although we do know that the uptake among the residents has been much better. It's been a challenge we've been working with, trying to make sure folks understand the need. We know that the long-term partnership folks are doing their 3rd visit coming up soon, and they're going to offer new first doses. And so it's another opportunity. So, it does speak a little bit to some reticence. One of the things that we've heard is not necessarily the medical staff, like the nurses and physicians, as much as it is other employees. So I think it speaks to other broader issues in the state. But everybody needs to get the vaccine, and especially if you're taking care of vulnerable folks, it really is horribly concerning, and frankly a little bit selfish to not get vaccinated if you're taking care of vulnerable folks.
Dr. Byers, anything to add?
No, just just understand that, when we look at the uptake in facilities, we have seen better uptake among the residents than we have among the staff, and that's not surprising. We are encouraged by that, and we certainly would like everybody to get vaccinated. But really, the ultimate goal too is to try to protect the vulnerable population in that long-term care setting. If you think about how many folks we have in nursing homes between staff and residents, I think it's somewhere in the range of 30 something thousand, and with the assisted living centers, another 22,000 plus. And so and so far, about 25,000 folks in those settings have gotten a first dose. And so that tells you where we are and that we still have a ways to go.
Okay, thank you. So Bracy is asking, and we do work with incarcerated individuals. So Bracy is asking, how are vaccinations for incarcerated individuals who fall under the 65 plus category or have chronic health problems being addressed? Dr. Byers, I think you can talk to this.
Yeah, so we're working with places like the Department of Corrections to enumerate the number of individuals that they have who fall in those categories, either staff or inmates or detainees, the incarcerated individuals, and supply them vaccine. And we have already started doing that, and we're doing that for private prison settings. We're doing that for the Department of Corrections to make sure that the vulnerable individuals in those settings get vaccinated as well. And we'll continue to provide the number of doses needed until we get those folks vaccinated.
Okay, and thank you to Jim, Craig, and Thomas for providing that hotline number. Anita, does the 45,000 weekly doses coming to Mississippi include Walmart? No. As Dr. Dobbs said, that will be separate, and that is, Dr. Dobbs, the federal allocation, right?
Yes.
Okay. All right. Keisha from the Clarion Ledger. I know the site won't be live until tomorrow, but will the full URL be provided with the list that can be released later today? So we will release the list. Paul, anything about the full URL being provided?
Yeah, we'll provide that as well, just with an understanding for folks that it's not going to be live till tomorrow morning. So you won't be able to go on that Walmart site and make an appointment until tomorrow, with the projected first vaccinations being started on Friday. So if you're making your appointment now, understand that they're not going to start vaccinating people until the end of this week. But that should go live tomorrow, and we'll have that published.
Okay, I think, Keisha, that answers your questions. I don't see any last questions, so I'll turn it over to Dr. Dobbs. Any last words?
Just please, we're making great progress. Let's please keep up the good work, wearing masks in public, limiting social gatherings, try to keep it small and outdoors. We want to get to the summer, taking as many people with us as possible. Now's not the time to let down on guard.
Okay, Dr. Byers?
No, just to echo what Dr. Dobbs said, that we've made some progress. We're seeing some declines in illness and the number of deaths, and we sure would like to see those continue as we ramp up our efforts to vaccinate as many people as possible.
And Jim Craig?
Yeah, if you're working in a long-term care facility in the state of Mississippi, first, thank you. Thank you for doing that. I know it's been a tough journey this year, but please get vaccinated.